Joining us now is former acting CBO Director and economist Don Marron. Don, with the Democrats unified in opposition, Republicans can lose no more than 2 votes. Will this week's CBO score sway Republican votes one way or another?
Well, you know, the score is probably going to show that the revised bill that we see now in the Senate is still going to cost a substantial number of people to lose health insurance over the next decade. You know, we don't know how much, 15 million, 18 million are numbers we've seen out there, and likely more in the decade after that. And I think figures like that are going to give people pause.
But, Don, I want to point out, and I've said this before, that millions of the people in that number, even in the CBO score of the House health care replacement bill, that they lose insurance by choice because they're no longer mandated. They will choose not to buy it because they're no longer mandated by the government and penalized by the government for not having health insurance. That it's not that these 23 million people will get kicked off the rolls.
Well, so there are a couple of pieces of it, right? So some of it will be people choosing not to buy insurance, and then a lot of it will be people who lose access to Medicaid. The original health reform we had under President Obama expanded Medicaid significantly, provided funding for that. The Senate bill is going to walk it back significantly more as we get into beyond the 10 years. And so you'd see, you know, probably 10 million or more fewer people on Medicaid.
Don, how important is it that this administration, as well as the Congress, wants to remove the taxes that are in Obamacare on investment, the 3.8% tax? I was reading your website. It seems that you're more of a consumption tax kind of guy. So how pivotal is this for the health care bill going forward?
Yeah, you know, if you let me do my think tank thing and go up on the whiteboard and design for you a perfect system, I would probably expand health insurance coverage and finance it with a consumption tax. You know, we don't live in that perfect world, and the compromise that was able to be enacted under President Obama was basically to finance the expansion primarily with taxes on investment income. Repealing those is something that obviously seems to be a very high priority for Republicans, and the trick for them is to design a bill so that the savings they get from walking back health insurance coverage are enough to pay for that.
So now the bill's going to potentially be revised before it even gets to a vote. Will the CBO do another score? Does it even matter what the score is? And how dramatically different could the score be from the prior score?
Yeah, so what we saw on the health side, you'll remember we actually saw 2 CBO scores of the House health bill. The first one was in advance of their debate and their eventual voting. But the second time around, the House did not leave enough time for the CBO to finish its score, so they voted and then the score came later. It seems like we're going to get a CBO score of the Senate bill possibly today. There are proposals out there to make some tweaks, for example, to do stuff to encourage more people to get individual insurance. But it's not clear, given the Senate's timeline, whether they'd give CBO enough time to score that fully before we see a vote.
So I'm curious, as you're looking at this, what are the pros of the plan that's out there? I think we're all talking about what's wrong with it, but I'm not really talking about what's right.
Even Republican senators are talking about what's wrong with it rather than messaging what's going right with it, Don.
Well, sure. So obviously what's right with it is going to depend on your perspective. Folks who worry about taxes on investment returns, worrying that that's going to discourage economic growth, would be happy to see some of the tax increases on investment go away. I think many people are happy about some of the things you don't see in these bills. So, you know, you don't see a walk back on the ability of children to stay on their parents' plans up to age 26. You don't see repeal of pre-existing conditions. So there are various things like that that seem to be have enough bipartisan support that they're going to continue to exist. And then you have a real fundamental issue about how you want to think about Medicaid going forward. And there's a group of folks out there who want Medicaid to be, in essence, an uncapped entitlement, as it has been traditionally, who are understandably very concerned about the design in these bills. And then you have other folks, predominantly on the Republican side, who'd like to see more of a fixed budget for Medicaid, under which states could have more flexibility to make decisions about how they allocate the money, and some of them are quite enthusiastic about this reform.
Or at least a move back toward what Medicaid was initially intended to be, and that was health insurance for essentially the very poor and single moms and their kids. And we've gone so far away from that. It was already moving away away from that, Don, even before the expansion of Medicaid to include as part of Obamacare. And people are legitimately worried about the mushrooming costs of this program and the greater government control that bureaucrats have over people's health insurance and health care.
Right, and the cost of Medicaid is a significant challenge. If you look out into later years, healthcare costs typically grow faster than inflation, typically grow faster, in fact, often than GDP. And we haven't quite figured out how to pay for that over the long run. And so the Senate bill is trying to tamp that down even more than the House bill did. But the challenge with that is if you don't figure out some way to keep healthcare costs down, the implication of that is going to be that people get either less quality coverage or fewer people get coverage down the road.
Don, is it one of the biggest...
I just want to point out, to explain something that you were saying, not to get in the weeds, but it's worth pointing out, that the Senate bill does with these Medicaid grants. It pegs the grants to inflation with no adjuster. That's why it's a little more dramatic in what it does with Medicaid versus under the House bill, there's like a 1 percentage point adjuster in terms of the grants plus inflation. So the Senate bill actually does a little bit better job of controlling those costs.
Yeah, I mean, Don,
well, so better or more severe, right? A really important feature of the Senate bill is that it switches to just increasing the amount per capita per person at the rate of inflation in 2025.
Right.
So that's something that doesn't really show up in the traditional 10-year budget scores we're going to see, but would have a major effect in the second decade.
Yeah, but Don, isn't one of the, as an economist, I mean, isn't one of the biggest costs we're seeing is that wages are not going up? Wages are really stagnant here because the cost of healthcare is the second largest cost that employers have, and then we're also seeing wages not go up. So as healthcare keeps rising, it's actually hitting people in their earning potential.
You know, absolutely right. When we leave the Medicaid folks and we go over to, working folks who have employer-provided health insurance or people who are going to buy on the exchanges, right, a significant challenge is, just as you said, right, healthcare costs have been rising much more rapidly than people's wages, their compensation. It's been one of the things that's been keeping wages down in the last several decades. And we still have a major challenge of figuring out how to limit the growth of healthcare costs in a way while still ensuring that people get good health insurance.
Don, good to see you. Good to talk to you as always. Don Marron.
Great, thanks.